I'm Christopher Nolikin at Veterinary Hospital.
Hi, I'm Lindsay Renzullo.
Talking today about allergies in pets.
Spaying and neutering your pet.
Pet weight management. And we're going to talk today about pet summer fun and safety. But doctor.
Mm-hmm.
So she says, I got
You're good girl. You got a lot of treats. A lot of
TD
TD treats.
Up on that table.
Hi, welcome to the next episode of the podcast. I am Dr. Lindsay Renzullo.
I'm Dr. Christopher Nolikin.
And we're very happy to have you all here today. So today we actually wanted to talk a little bit about something sort of different. It was just about, the differences between different types of veterinarians.
Right. So, in our field we have a lot of confusion, I think, sometimes about what you should do, where, and seeking the care of whom.
Yeah.
Whom, right?
Yeah, whom.
Okay. So, the rough categories that we have general practice vets, we have emergency vets, and we have specialty vets.
Yeah.
So we both work in general practice. What would you describe to a pet owner that you do?
Yeah. So, as a general practice vet, I mean, you basically are the internist of your pet's care. So you basically are
the primary care
physician is better terminology. And I think this question got brought up really before I answer that. Looking at human medicine and the vast differences between that, because I shouldn't say vast, but there are differences between human medicine and veterinary medicine. A lot of times when you go to your general practitioner or your primary care doctor, if you will, you have certain things that primary care doctor will do, but there's so many specialties and subspecialties of human medicine that sometimes that, primary care doctor has sort of limited abilities at their facility or what they're capable of doing. And in veterinary medicine, we have a lot of specialties and a lot of, other types of subspecialties, if you will, but it's the rules aren't sort of as strict. Right. And so, we both are general practitioners, but we also are both emergency doctors as well. And so as a general practitioner, if you are going to your veterinarian for general practice, I mean, we're the ones that are there to sort of help you with all, routine care. So, the vaccinations, dental care, making sure your animal's on appropriate preventatives. You're talking about diet, nutrition. You're doing all of that in the general practice appointment. And so, where you might send or you might sort of refer, or be referred as a human patient to various different specialties, the general practitioner really does a lot of stuff right there in the office, which is great.
Yeah. So we kind of view it as the way that the field, I think, should move and really is moving is that general practice doctor does really serve that same function as your primary care doctor, but in our field, they're sort of serving as the keeper of all of the information about the pet. They're trying to be the person that sees your pet probably 95% of the time, right? Yep. They're going to see your pet for its wellness care, try to keep it out of trouble. So try to do things to help you to keep your pet out of the emergency room or out of sick care. But when your pet does have an illness, any kind of illness, from easy to hard, they're going to see them and take care of them.
Yeah.
And there's a variety, I think, in what general practice doctors choose to do or can do. So you can be as broad as you want to be, and a lot of general practice doctors do develop things that they're really interested in. Like, you love eyes.
I love ophthalmology. Right. I feel like if I was to specialize in one particular field, that probably would be the field I would specialize in. And since I have such a passion for ophthalmology and being a veterinarian, you have a little bit more leeway in learning different things that you can do to sort of advance your abilities in that particular field. So, a lot of certain procedures that, you would be a general practitioner that's not necessarily as comfortable with eyes, because I've done some procedures and I've had great mentorship with an ophthalmologist, I feel more comfortable doing those types of procedures. And, as a general practice doctor too, you go to your general practice or your primary care physician, you have a lump or a mass on your arm, they're not going to be the ones that's going to be removing it. It's going to be a surgeon if you're a human in that particular case. A lot of general practitioners will feel comfortable doing something like that. right? You would feel comfortable with your patients.
So, you know, with my patients, I do, and
Yep.
Lindsay as well, you know, I do their spay surgeries, their neuters, I do their lump removals. We both do a lot of emergency surgeries, and so if your dog came in to see me and had eaten a foreign body, ate a Super Bowl, we would both be able to remove that. And most general practitioners do have that sort of level of knowledge
Yep.
and comfort with those things. Sometimes they've gone and received extra training, like we were talking about ophthalmology. There are doctors that have gone to learn a particular orthopedic procedure to fix knees, and they are allowed to do that, and they can do that, and they can do it quite well in most
Yep.
cases. But there are times when that's not enough. So
Right.
in terms of specialty care, each of these fields that exist, surgery, ophthalmology, you think about these things in human medicine, they also occur in veterinary medicine too. Probably not to the same degree, right? So in
Right.
veterinary medicine, there's a cardiologist, but there may not be a specialist that only does valves. You know,
Yeah.
they tend to be a little bit broader. But
Yeah.
when would you send someone, let's say you're seeing a patient in an exam room,
Yep.
what are some situations that you would send to a specialist?
And that's great, and that's what you need to feel comfortable with your general practitioner about, is because, you know, when you're going and seeing your veterinarian, your general practitioner, they should be able to have all of the tools and all the knowledge to basically be able to assess your pet and be able to tell you what you need and whether or not they feel comfortable handling a particular situation or a particular disease process. And so, you know, certain things, you know, when we pick up on physical exam or we find through diagnostic testing, we might say, I would feel more comfortable if you actually see a specialist about this because here are the reasons why. And so a perfect example is, you know, you're listening to a dog or a cat and you hear a heart murmur. I can be able to tell just by listening that there's a heart murmur there, but I can't say why that patient has a heart murmur or if that heart murmur is something that's going to be, you know, something significant. And so at that point I would say, I recommend that you see a veterinary cardiologist. And the reason being is that those veterinarians specialize in only cardiology, and all they're doing is seeing patients that have heart murmurs or cardiac abnormalities. And what they're going to be able to do is offer you more testing that I wouldn't necessarily be able to do. The big one being an echocardiogram, to be able to ultrasound and visualize the heart. And they have a skill set in doing that that is something that, because they do it every single day with multiple different patients a day, and because they've had advanced trainings and they've become board certified in that field, they have more of that knowledge that you want them to be able to assess your patient or your pet for any kind of heart issues.
Yeah, and like the training is a key thing. So, you know, to be a vet, I think talked about this a little bit before, you go to college for 3 to 4 years, you go to vet school for 4 years, you take a licensing exam, and you're a vet. And many have done internships or other training, but I don't have to have done those things. I don't have to prove anything more beyond that. When you are training to be a specialist, so a cardiologist, for example, goes for a residency for 3 years. They do hearts, 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 only hearts.
Yep.
They learn it from a qualified mentor who's board certified, and they're learning all the current research, and then they're taking a really difficult exam in all of these fields to prove I know what I'm doing. And that, I mean, ophthalmology is a prime example. Like you like eyes.
Love eyes.
And you do all of those surgeries, but there's some things that you can't learn from a book. You can't learn from experience, like cataract surgery is one.
Absolutely. I mean, there are ophthalmology cases that I 100%, even though I really enjoy ophthalmology and I enjoy eyes, I would never, you know, dream to sort of venture into trying to do those advanced procedures. You know, cataracts being a great example. You know, as a general practitioner, you know, that's sort of out of my scope of what I would feel comfortable doing.
And for me, it's all eyes.
Yeah.
And it's orthopedic things, right? So I don't have any interest in fixing bone fractures.
Right.
Some vets do, and that doesn't mean you should always seek a specialist. I think you need to have a relationship with your general practice doctor to understand what they might be comfortable with. But it's sort of a little bit of a red flag for me, you know, like when I'm looking at what my, you know, colleagues are doing at our hospital, like, it bothers me a little bit if one person says or proclaims that they're doing everything, because I truthfully, I know that I can't do everything. It doesn't mean that they can't. Maybe they're amazing. But I agree.
I mean, it's hard to have, it's such a large skill set that a veterinarian needs, that it's hard to be good at every aspect of that skill set. And so, there are some veterinarians that are really great at sort of managing diabetic patients, or great at doing surgical cases, or great at sort of handling an emergent or critical patient that's coming in. But it's really hard to be really good at every single aspect of it. And in human medicine, they sort of made it easier, if you will, in the sense that they don't put all the pressure on your primary care doctor to also do all of your surgeries or any emergency surgeries as well. They don't have that responsibility. So, having the ability to do it all doesn't necessarily mean you should be doing it all. So,
right.
Yeah.
I think that's, the probably parting words about general practice maybe that I would say are, if your vet says, I don't feel that I'm the right person to do this, you should listen to them.
Yeah.
They're really advocating for your pet. So at some point they're going to say to you, gee, I don't do foreign body surgery. I'm not good at it, and I want you to see a surgeon.
Yep.
And they're giving you the truth, and they're telling you what you should do.
Absolutely. I mean, and I think that listening to them and what their comfort zone is really important. I mean, there are some masses even where a mass removal is something that a general practitioner is able to remove, and there's some of them that I'll feel on examination. I said, to be honest with you, I'm not comfortable with this. It's either in a really tricky spot, it's going to need a graft, it's going to need some sort of, intensive, care. I think you need to go see a surgeon, and they're going to be equipped for it, because that's, again, what they do every single day. So it is important to listen to them and listen to what their comfort level is, because as a general practitioner, we really are there to sort of make sure your pet is healthy from the time that they're puppies till they're older, and in that period of time, finding the appropriate things that you need to do, whether or not it's consulting with you or going and seeing somebody else.
And then emergency, we kind of glossed over that a little bit, but emergency hospitals are out there, and they're there for a lot of reasons. The main thing, general practice doctors used to do all of their own emergencies.
Right.
And the field has moved to the point where we know we can't do everything and know everything, and weren't providing great care to those animals as well as they were during the day. Right. And they can't do everything. They can't work 24 hours a day. So the emergency hospitals have kind of blossomed as this great thing for general practice doctors to be able to make sure your pet gets cared for, but it doesn't always have to be them. And that's wonderful. Yeah. Amazing.
Yeah, definitely. And with emergency medicine, I mean, that in and of itself is a specialty, is a field. And so somebody can go on and get, board certified in just taking care of those super emergent cases, which is a great thing to have, those doctors. And so, emergency medicine, the hours, the staffing, we just don't have the capability with just all the general practitioners, again, to work all day and be on call all night every single day of the year. So having those emergency doctors is really great.
Yeah.
And the care of those emergency doctors, as far as what they can provide, very similar to what we sort of talked about with general practitioner doctors. There are a lot of things those emergency care doctors can do, and they do really, really well. But there are certain cases, certain particular cases, or certain emergent cases that come in that might require something really, really specific, like a ventilator or something, let's say, and they really feel like that a critical care doctor would be the best doctor to be on this particular case. And so, you have to listen to your doctors about when they're talking about the time for referrals to somebody even more specialized.
Mm-hmm. Yeah, so, and, another kind of guideline maybe for you is, to understand that emergency doctors can't do everything either.
Right.
And while you might think that, well, I need to have this thing seen right now, I never want to tell somebody, don't go to an ER for this, or do go to an ER for that. If you're worried about your pet, you got to go.
Yeah.
Right? But managing chronic diseases, skin diseases, ear infections, things that you wouldn't say, like if you would go to the emergency room for it.
Yeah.
They can do the initial treatment, but you're not going to probably get the same like satisfaction in terms of follow-up and chronic care. You know, your dog has an ear infection, they're going to be able to treat it, but they're not going to be able to fix all of the allergy problems that probably caused that at that visit. So they're going to suggest that you go back to your doctor now to talk about the next steps.
Yeah.
And sometimes they're not. Sometimes waiting a day and seeing your doctor that knows your pet and knows that your dog gets an ear infection every March or whatever, sometimes that's the better choice. You have to decide what's better for your pet. And again, I'm never going to tell anybody, don't go to the emergency room.
Yeah.
But it is the kind of thing that everyone has their level of expertise.
Yeah, absolutely. I mean, and you know, that's why in some ways, you know, having emergency rooms available, it's always a great thing. We always can feel very secure that we have a place to go. But yeah, I mean, your regular vet is very important too as well.
And you're going to pay more for that ear infection.
You definitely will.
So, you know, that's something to mention is that, you know, general practice care is thought of as being, you know, kind of more cost effective, I think, than the other types of care. But there is a reason for that. So an ER has to maintain its hours 24 hours a day.
Right.
And I don't think that it gets the proper due in understanding that the staffing costs, the costs to keep the lights on, the costs to maintain the kind of next step up in equipment, they're astronomical.
Yeah.
Like, that's amazing.
Yeah.
And that's true of specialty care too. So, you know, those specialists are going to need a scope.
Yeah.
Does everyone know how much these scopes cost?
They're expensive. This stuff's expensive.
You know, $100,000 to get an entire setup for some of these things. The digital X-ray, not dental, that was $68,000.
Yeah, it's expensive. It is expensive, and a lot of the stuff is top grade medical equipment. You know, so it is something where, you know, we're pinched with those prices too as well. So we're feeling it.
So that's kind of to give you guidelines about, you know, the different tiers of pet care and understand kind of what goes into those things.
Yeah.
Do you want to talk about pet food myths and the
I
grain-free phenomenon?
I think it's great. I mean, we hear, you know, pet foods nowadays, our owners nowadays are coming in and talking about all the different types of pet foods that are on the market, and it's honestly overwhelming. I mean, I personally, you know, they come and they say they're on X, Y, and Z food, and sometimes I've never even heard of the brands because, you know, there's so many brands out there. I'm sure if you go into a pet food store, you know, especially one of these more boutique brand foods, you look at the aisles and they're just filled with different companies, different food types. And so the market is there for sure. You know, people want to feed their pets good, healthy diets. I think we're now more cognizant of what we're eating nowadays. People are more, you know, into, you know, organic and, what am I putting in my body, and I want to make sure whatever my dog or my cat's putting in their body is good too as well. Yeah. And so because of that, I feel like we get a lot of marketing on these foods that talk about certain types of, you know, great thoughts or great things, you know, things like gluten-free and grain-free and all that stuff. And, you know, I don't know, Krista, what are your thoughts on some of these grain-free diets?
I think that when I get a lot of owners that say, almost in this exact same terminology, that, oh, he's on the best food, it's that grain-free food. And I think that we've equated grain-free with best. Mm-hmm. And I think that needs to separate. So that's kind of my biggest concern, is that grains are not the devil. Right. Grains are not bad. To make a dry food, so that those dry kibbles, you know, that we have and that we feed our animals, you have to have a certain amount of carbohydrates. Carbohydrates are a macronutrient. They're one of the things that most animals eat. Most of the even carnivores do eat some carbohydrates. They eat them when they eat the full animal, and that animal in its guts has carbs. Yep. So they are eating carbs. Carbs are definitely kind of controversial. Yep. Right. So like cats
are a lot, you know, more carnivorous. You know,
obligate carnivores.
Eating meat, and so, you know, with cats, you know, you start thinking about, well, should I just be feeding them just a straight protein diet? And it's really hard. I mean, because, you know, I can see where people would necessarily think that way, but on the flip side, you know, we have talking about specialties, veterinary nutritionists, so veterinarians that have gone on and specialized in veterinary nutrition, that do approve, foods that do have a balance of proteins and carbs within them that are commercial brand diets.
So, grain-free, that term grain-free, just be clear that does not mean carb-free. So you have a dry food, it has carbs in it, and it's going to have potatoes or peas or something to make it carbohydrates.
Right.
So ask yourself, is a potato better for my dog or cat than rice? And I would argue that neither of those is better or worse necessarily, but just because it's grain-free, it's a potato.
Okay.
Potatoes are a carbohydrate. So that's just the thing, my feeling is we should be evaluating these diets as a whole and not saying, oh, it's grain-free. It doesn't mean as much.
Doesn't mean as much. It really doesn't hold it. And I think a lot of times too, and sometimes, and maybe you can correct me if you're wrong, a lot of clients think that if we are concerned about their dog or cat having some sort of food allergy, they think that a grain-free diet then is the diet that shouldn't be an allergic diet, or it should be a hypoallergenic diet as well. So some clients think that, oh great, so my dog or cat might have a food allergy, I'll put them on a grain-free diet and then we're good to go. And that truthfully, honestly, is not what most dogs or cats are allergic to in their food. A lot of the proteins that cats and dogs have allergic responses to are things like chicken and beef, and so soy. So it's not necessarily something that saying it's a grain-free, it's also a hypoallergenic diet. That again is not true either.
Right. So and gluten-free is sort of not a thing in animals. So gluten is a protein. And it is a potential allergen, but it's down on the list, like 3 or 4 down on the list. It's certainly possible, but grain-free means all grains. So you're not just eliminating wheat, you're eliminating any grain, and there's just not a lot of sort of scientific basis for that. So that's
just be aware when you go out there. I mean, the pet food market right now, the marketing on it, can sometimes be a little bit deceiving and hard to read through labels.
Lots of shiny labels.
It is. It's a lot, and it makes you think that you're buying the best food. It could be the most expensive food. But I tell my clients a lot of times, if you are allergic to steak or beef, and you go to the finest steakhouse in Boston and you order a filet mignon, you're going to have a reaction to that. It doesn't matter if it's the best diet. You have to have the best diet for your pet. And so making sure that you don't get necessarily distracted by a lot of the shiny labels and the cool marketing techniques or the cool marketing strategies. Try to look out what's best for you.
Yeah, so that's it. So last but not least, we had hit upon in a couple of episodes ago just kind of some basics of what is involved in cat care. So we thought we'd hit upon dogs now, since they're probably one of the most popular pets that we have.
They're a pretty popular pet. Everybody loves their doggies and their
So if you're thinking about getting a dog, what is going to be involved in their care?
I don't know if you feel the same way. I feel like dog care is a little bit more involved than cat care. You have everything from appropriate socialization behavior things because you're taking your dog out into public, to health concerns and making sure you have appropriate preventatives and foods and stuff. So it can be a little bit, it's normally a bigger discussion when we sit down with our puppies, our puppy owners. And so one of the first things I talk to the owners about when they come in is like, what's the lifestyle going to be of your dog? Is your dog going to be, out there with you, like going up hiking, trying to figure out and pinpointing the appropriate types of vaccines that we're going to need to give our dogs. Look at that cute guy. Yeah. It's adorable.
So I mean, dogs in general, they're pack animals more so than any of our cats are. So they're going to be like there with you. We call them sometimes Velcro dogs. There's some that are more than others, but your day in the life of a dog is going to be, you're going to be feeding them, you're going to be bringing them outside in whatever way. That could be letting them out into the yard, or that could be taking them for a walk, but generally speaking, they don't use litter boxes. There are litter boxes for cats,
or
but
those
for
puppy
dogs,
pad trained dogs.
But you're going to have a little more involvement with that. They kind of require more just general attention and play. I know my dog comes up to me with a toy, like right when I'm really tired and she wants to play, like tug. So they sit like on you, a lot. So they require a lot more just general attention.
Right. And I think cats and dogs, you know, in some ways, it really does depend on their personality. Some people will say that their cats are the very same way. Some dogs are very, you know, aloof and don't want to have as much attention. But, you know, having a dog and caring for a dog, I do think in some ways the socialization aspect is a little bit more you know, important, especially in those first weeks, and as your dog is older, you know, having your dog be able to be acclimated to other people and other, you know, animals and children and things like that is really important, because, you know, you don't want to have, you know, people coming over your house and having your dog, you know, growling, barking, biting, you know, at them. Yeah. So it's important to get that socialization in there and making sure it's a good companion, because that's really what they should be. They should be happy companions. He doesn't look too happy because he's getting a shot, but they should be happy companions. You know, animals that you know, pets that you can take with you and feel great having around.
Yeah. I think that's the biggest thing that I'd say is, you know, they require that you've decided they're joining your life.
Yeah.
You know, that they're not just necessarily part of the house or something that the kids have to take care of. It's a family thing. Yep. You know, or if you know you're a single person, it's still, you're responsible for that life, but in a more kind of involved way.
My mother-in-law actually has a little towel hanging up in her guest bathroom that says, you know, dogs have people, cats have servants. And it's true. I mean, in a lot of ways, you know, when you are a cat owner, and this is obviously not for all cats, but you are at their mercy. Like, if they like to get pet or not, you know, if they want to be around you or they don't, you know, they're going to let you know what they want. Whereas majority of the time, dogs are going to be more social and really wanting to be a part of your family. So it does take a little bit more care. Again, tweaking vaccinations, making sure you have appropriate preventatives, you're on appropriate food, you know, there's all really important things.
I think they tend to get into a little more trouble, and they tend to be a little more expensive medically.
I agree.
As well.
We do see the occasional cat that will eat something, but for the most part, it's the dog ate the sock. Or
dog ate the sock, dog ran out and got hit by a car, or, you know, the dog, whatever. Yeah. The dog got bitten by another dog.
Yeah, dogs are
a little more trouble.
But they're great.
And there's a lot more variety, I will say, too, in dog breeds and the trouble that they get into as a breed. So that's another thing, is that the disparity in sizes and shapes and everything among different dogs is pretty significant. And a lot of the problems that we run into with them are related to that. Yeah. And cats are, you know, kind of, not one size fits all. There certainly are cat breeds, but they don't vary in sizes. Imagine a Great Dane-sized cat.
Like a lion. I actually I would have to get one. I would have to get one.
Right. But like being the vet of that animal, because you know you can't control them.
It'd be very intense. Yeah. But we love, I mean, obviously we love dogs and cats, obviously. They all have their positive parts to them and their negative parts, but they're great. And so, you know, if you're definitely interested, if you're looking into getting a dog or you want to get a dog, they can be awesome members of the family. Definitely, we highly recommend them. We think they bring a lot of joy and happiness, but they can be a lot of work too as well. Yeah.
Yeah. So that's our show.
Thank you guys for coming and joining us again. We really look forward to seeing all of you next time at the podcast.
And email us with any questions.
Yes.